So this is the trauma classification series. In this video we will discuss about the classification of neck of femur fractures. So first is the Powell's classification. So this is very basic classification which is based on the vertical orientation of the fracture line. The angle, what angle the fracture subtends to the horizontal plane. So here the angle subtended is less than 30 degree. So this is the type 1 of the Powell's neck of femur fracture. In type 2 it is 30 to 50 degree. So if the angle is 30 to 50 degree from the horizontal, it is known as type 2 of the Powell's classification. And if the angle is more than 50 degree, it is known as type 3 of the Powell's angle classification. So this also indicates the prognosis. So if it is type 1, angle is less than 30 degree, it is a good prognostic sign. And if it is more than 50 degree, it is the most unstable fracture and it has the highest risk of the non-union and avascular necrosis. So this is again the Powell classification. First is less than 30 degree, then we have 30 to 50 degrees, and then the type 3 we have more than 50 degrees. Second type of classification is the anatomical location of the fracture line. So as we know that the neck of femur fractures are the intracapsular fracture, and the intertrochanteric and the subtrochanteric fractures are the extracapsular fractures. So in neck of femur fractures, we have the three types. The most proximal one is known as the subcapital fractures. The middle one is known as the transcervical neck of femur fracture, and the most distal one or the basal one are known as the basicervical fracture. So we have subcapital fracture, we have transcervical and the basicervical fracture. So this comes under the anatomical classification of the neck of femur fracture. Third is the garden hip fractures classification. So it has four types. In type 1 we have the incomplete or the impacted fracture. Here it is valgus impacted fracture, as the fracture is impacted in the valgus position, and it is incomplete fracture. In type 2 it is a complete fracture but there is no displacement. So the fracture line is extended from the superior and the inferior cortex, but there is no displacement of the fracture side. In type 3 it is complete fracture and there is a partial displacement of the fracture fragments. And finally in 4 we have the complete fracture and there is a total displacement of the fracture fragments. So this again indicates the garden fracture classification. So this is in line with the trabeculae. So these are the normal trabeculae in the head and neck of the femur bone. So in case of the type 1 garden fractures, it is a valgus impacted. The trabeculae, they come in a valgus orientation because of the impaction at the superior cortex because of the valgus force. In type 2 we have the complete fracture line involving both the superior and the inferior cortex, and there is no displacement. It is an undisplaced type of the fracture. In type 3 we have a varus orientation of the fracture trabeculae. So the fracture trabeculae are in the varus orientation. There is a partial displacement of the fracture fragments and we have a complete fracture line. In type 4 there is a complete displacement of the fracture fragment and also there is a complete fracture line. So this is the garden classification of the neck of femur fractures. So these three classification, Garden, Powell's and the anatomical classification, so these are all classification for the acute cases of the neck of femur fracture. In cases of neglected femur fractures, neck of femur fractures, we have a classification by name of the Sandhu's classification. So here in this case, we classify into three categories, 1, 2 and 3. So these three categories, they are decided upon by the four features. So first is what is the type of the surface of the fracture ends. So if the fracture ends are regular, if they are smooth and sclerosed, or if they are totally smoothened end of fracture sites. Second important point here is the size of the proximal fragment, which is the head fragment. So if the size of the proximal fragment is more than 2.5 centimeter, if it is more than 2.5 centimeter and if it is less than 2.5 centimeter. Then third criteria is the gap between the two fracture fragments. If it is less than 1 centimeter, if it is between 1 to 2.5 centimeter, if it is more than 2.5 centimeter. And lastly, fourth criteria is on MRI, which is the viability of the femur head. There is no sign of AVN, the head of femur is still viable, and in type 3 we have the presenting signs of the AVN. So these three criteria, they are decided on CT scan, while this fourth criteria is decided on the MRI scan. So by checking on CT scan and MRI, by deciding the surface of the fracture ends, by deciding the size of the proximal fragment, by measuring the gap between them, by deciding the viability of the femoral head, we can classify the neglected femur fractures, neck of femur fracture, into Sandhu type 1, type 2 and type 3. And then we will decide upon the treatment or management of that non-union neck of femur fracture. So if it is stage 1, the head is still viable, we can preserve the head. We can either go for the open reduction and internal fixation with the help of CC screw or a blade plate along with the fibular grafting, or we can go for the open reduction and internal fixation with the muscle pedicle bone grafting, or we can go for the valgus or the McMurray osteotomy. In stage 2, the head is still viable, so again we can go for the head preservation surgeries. So we can go for the open reduction and CC screw fixation with fibular grafting. We can go for the open reduction of the fracture with freshening of the non-union and with fibular grafting or the corticocancellous bone graft, or we can go for the muscle pedicle grafting, or we can go for the valgus osteotomy or McMurray osteotomy. In stage 3, the AVN has set in, so there is no point in preserving the head of femur. So we go for the replacement. We either go for the hip arthroplasty very commonly, or in some cases we can go for the excision arthroplasty known as girder stone procedure. So this Sandhu classification is on the neglected neck of femur classification, neglected neck of femur cases, while the Powell's, Gardens and the anatomical classification is for the acute cases.